I have insurance through my job, but I've got 4 kids and it's expensive what I have to pay for them. And I don't have my husband covered because it's too expensive to have him covered. He's on his own. But the deductible that I have to pay is so high that when the kids are sick, I don't take them.
I'm a 35-year veteran on my job, so I do have good health insurance. But I also have a medical issue, so if I was to leave my job or lose my job, then I wouldn't have health insurance.
My concern is the quality. I had a recent visit at the emergency room. I had stayed about 13 hours. It was one doctor on staff, and I just didn't feel like I got quality care.
I believe whether you work at McDonald's or you're building ships out of Trinity, everyone should have at least the same opportunity for health care and insurance coverage.
I'm currently uninsured, and I have a problem paying, trying to pay my medical bills because I have a lot of illnesses, but I don't think the government should be able to be involved in making our decisions on our health care.
If government takes over our health care, what will they want to control next?
Even though a lot of people are saying the government shouldn't be involved, but somebody needs to be involved.
In our perfect world, we're going to have less expensive health care, be it including a lower deductible or medication costs. Although it's less expensive health care, we don't want to sacrifice quality.
Everybody's going to want to see this, and they're going to use it, and it's going to be a very easy and capable way of getting to it. People go to the exchange to choose insurance for themselves and their families.
You know, everybody is different, and just because what fits you now may not fit you down the road.
We were concerned that the coverage be not tied to a specific job, be something portable that you can take whatever your work circumstances become.
Accessibility to all. We feel like everybody should be able to do this with or without a job.
I don't want to see small business suffer because of the regulations. And we need jobs, especially here in the desert. We need jobs. We don't need to be to the point that the insurance keep people from having small business.
We want a wide range of choices when we're selecting our insurances or the insurances that our jobs offer to us with no hidden agendas.
And we always want it to be a choice. The insurance be there, be affordable, be available, but it's up to you as to whether or not you get it.
Everyone has different issues health-wise, so I think that it would be more beneficial if we can kind of shop to a tailored plan that tailors to your health needs and as well as your family.
People on the exchange have an extra set of rules they have to play by. And I think that, if you want to choose somebody outside that exchange who doesn't have to play by the exchange rules and by what the rules exchange set, because frankly we don't know what they're going to be, that you should have that option to be like, okay, I don't really want to mess with the exchange. I want to go to my private agent I've been doing business with in 20 years and go with him.
Who will run the exchange? We agreed that the public and private partnership, healthcare providers, consumer representatives, and a mix of insurers. We feel like that it should be a combination of everybody.
Let's have an exchange board representative of the private sector, 1 or 2. Let's have a public sector representation. Let's have a healthcare provider representation. Let's look at having insurance company representation on this board, and also John Q. Citizen.
Oversight. We said outside watchdog, public forum, and complete transparency. That's really important to us.
There has to be some type of oversight to make sure that these insurance companies aren't going to rip us off once this new law comes into effect.
One of, I think, our group was concerned was the amount of money that insurance companies make, their profits. It's the amount of money that they make. What we want to make sure that even if it's state, federal government, that there is some regulation in place to limit how much profit that they make.
If the company's making 15 or 20 or 40%, then somebody should say something. Somebody should do something. Something should be done about it. But if they're making 1% or 4%, then they have every right. We live in a capitalist country.
What we wanted was government to step in, but with limited power. We don't want them to come in and dictate everything that has to be done, but we do want them to regulate.
We think it's really important that the government not just say, okay, this is what we're going to do and this is how it's going to work and it's going to be this way forever. Because times change, and we think after a certain amount of time that a reassessment be done and we make adjustments to this so that we can grow.
The navigators will come from many backgrounds. Navigators will be available in many places, should be available to go to the person's job or to their home.
If you wanted access to a navigator, I mean, you still have all the online tools and access to information online, but if you wanted to speak with the navigator or meet with somebody in person, you had that option.
The navigator is not steering you one way or the other, just somebody who has a comprehensive knowledge of all of the plans and who can expertly guide somebody according to what their needs are.
I think navigators should be a little broader than actively reaching out to the poor and people in the rural, because I live in the city and I'd like to actively have somebody take my interest to heart.
To have a navigator that's not only educated, but that's also mobile, that can go to these people's houses and explain to them, like you said, to make them understand, you know, this is what you're getting, this is what you're gonna have, this is how to affect your taxes, this is how to affect your income. So I think to have that person to be mobile and educated is very important.
I think most of us, even though we listen to TV, we read the newspapers and so forth, we are not well informed in terms of what our government is doing in terms of the new health care laws.
I think everything is done behind closed doors so much, and we just give up because we think one person can't make a difference. Yeah. And I mean, I personally came here today just to sit in the back. I didn't think but I've learned a lot, and so this was worth me coming. Definitely meant for me to come because I didn't know enough about the new bill.
Everybody in here has been very open and honest, and you know, everybody's been respectful of everybody else's opinion, and I think that's we all should be very proud of that.
I think this forum today has been extremely helpful for everybody here, not only for me getting a little more education, which I need bad. All these people got some education today.
So a lot of times you're not going to hear this stuff in the news. It's very broad. You know, the lingo is very political, and it's really not for the common American. You know, this type of stuff right here gets down to the grassroots and lets us know exactly what we're dealing with.
There is a solution. You know, we are working on a solution. It's not just an argument about, you know, Republican and Democrat. It's, you know, there can be a middle ground because we all had different opinions on everything. And, you know, if we can come to common ground, you know, I would hope that the politicians would come to common ground.